So hi, I'm Marie Hopkinson. I'm a Chinese medicine practitioner. Welcome back to the Chinese Medicine Podcast. And this is a special series for students who are studying Chinese medicine. They want to know a little bit more about how Chinese medicine works. In this particular series, we're talking about the Zang-Fu, the organs in Chinese medicine and the functions of those organs. So if you're not sure whether this series is for you or what it's about, go and watch the very first episode, which is the intro. So I'm not going to get into that. I go over that again. You can watch the intro. So we're going to talk about the spleen today, and what I'm using in this thing is I'm using an old version of Giovanni's text, the Foundations of Chinese Medicine. Why am I using that? Because most schools use this text in talking about the foundations of Chinese medicine, and it really hasn't changed between the two different versions in terms of the actual main ideas. Like Chinese medicine's a system that looks backwards to the ancestors, not a system that looks forwards. So when new books like that are produced, they're more just like commentaries or new ideas about those old topics. So what we're going to be doing is going through the main functions, and I'm just going to be talking about them. And really, this isn't a replacement for your school teaching, your course, your own teacher. It's just something to go alongside that and just get another opinion and a different idea, and hopefully we can start a discussion as well for people that want to sort of discuss and help to understand things. I know as part of my learning, sometimes I learn, I get really inspired by, oh wow, that was really great, just hearing one thing from one person, and so that might be what this video is helpful for you, to just kind of consolidate something or get some knowledge that you otherwise didn't have. So, what are the functions of the spleen? What does the spleen do in Chinese medicine? Now, I'm not going to go into the transformation and transportation of food and fluids in a digestive sense as much as I did a video on this channel a long time ago, which was called Why Eat Mostly Cooked Foods. So you should definitely go and watch that video if you haven't seen that already. If you're a practitioner or you are training to be a practitioner, that's who this video is for students, that is a story, an idea, a concept you're going to have to tell your patients over and over and over again. And that's one of the reasons why I made that video. Because I was constantly explaining to my patients. Now, I still do explain it to them in the clinic. I still do go step by step and explain. I draw the little things. The spleen and stomach is the cooking pot on the stove. The essence is transformed upwards. Your spleen likes warm, cooked and moist. It doesn't like cold, dry and raw. Now, all that's going to be explained in that video in detail. So I'm purposefully speaking quick so we can just get through it. And you know that video is there. So what we're going to talk about today is more the physiological aspects of how it happens, what I wouldn't say to patients, but there would be that basic understanding there first. So that's the first function of the spleen. Now, how this relates to us in a clinical sense is one, okay, if a patient has poor diet, it definitely affects the spleen or the earth. So the earth is the soil of the ground, right? So when the soil's too wet, it gets watery, it gets bogged down. When the soil's too dry, it doesn't like that either, and the plants won't grow because it gets too dry. And that's that analogy, we can think of that in our body as well. So that's why our spleen likes warm, cooked and moist, because it doesn't like to be too dry, but it also dislikes cold, dry and raw. So this conundrum that the spleen and the stomach faces is kind of this saying where, I'm sure that it's written in this, I'm sure it's written somewhere in this Giovanni text here, that the spleen likes dryness and hates dampness, whereas the stomach's the opposite. The stomach likes dampness and dislikes dryness. So what is that saying to us? Well, both of them need a bit of both, and both of them don't benefit from an excessive amount of both. So how do we get into that position? This kind of dampness is usually from food. So overeating, rich, greasy, cold, dry and raw, these kinds of things. Now, the food aspect of how that happens, you can watch that video. I've also got another video of what is dampness. So once the spleen gets into pathology, it's going to be mostly a dampy kind of pathology, which means it's bogged down and it can't transform and transport. So the spleen, the yang of the spleen or the qi of the spleen, so in TCM they really talk about it as spleen qi deficiency as the pattern. But it's also, it's a yang function of the spleen, right? It's a functional aspect. And so what it is it's the ability of it's like cooking up a pasta on the stove and not having the stove turned on. It doesn't cook. It doesn't transform. The essences you won't get any aroma from that cooking process. It's not actually a cooking process. You just put the water and the pasta, and let's say you're making a creamy sauce or whatever you're making. You put your tomatoes and your cream or whatever you put in there, and it just stays. There's no aroma coming from that because you weren't able to heat it. So the yang or the qi of the spleen is that heating source, and qi and yang doesn't work very well when it's bogged down. It's a more of an ethereal substance. It's more like, it's less substancy and more free flowing, if you like. And so it certainly doesn't like that being bogged down, right? And so diet really plays a big role in this, and that would be when you're questioning a patient, you're asking them kind of about their diet, what do they eat and how do they eat and all that kind of stuff. So this transforming and transporting has two aspects to it. One is food and fluids. So food and fluids. So it's not just food. So food is the substances that are more likely to create a dampening effect, I guess. But fluids could also, I'm talking about the ingestion of the wrong foods. But fluid transformation is the ability for our body to lubricate itself properly, and also for the fluids to be in the right places. So if a person gets edema, which is like puffiness in the limbs and puffiness, let's say they get a puffy face, they swell up, then that issue is a fluid transformation issue. It means fluids aren't properly being transformed. And so the patient might have issues with urination, like they might not be able to urinate properly, they might not be urinating regularly, and all those fluids, instead of going into the bladder, those fluids are going into the limbs or things like that. So that's part of the questioning when you're asking about fluids. You might be, if they said they had edema, a logical next question would be, how's your urination? So you could work out if that's normal. Where are those fluids? Do they have profuse urination? And then another logical question after that would be about their thirst. So if they had, are they very thirsty and drinking lots of water? So one of the ways the spleen gets bogged down or doesn't do its job properly is if we just give it too much stuff, like people that drink way too much water. So you do need to drink enough water, but not too much water, and not insufficient water. And so how much water you need depends on, one, the climate that you live in. If it's really hot, if it's really humid, if your body's sweating a lot, if you're doing a job that's really sweaty, like you're outside, you're working, you work where I live in Perth, people work up north, which is, or even anywhere in Australia up north. The top, it's hot, you're in the mine site or something like that, can get up to 50, more than that, degrees. And if you're outside or you're coming in and out of air conditioning into that hot weather, you can really sweat a lot because it's so hot in summer. So those people need to drink more water. If you're doing a lot of sweaty kind of exercise, then yes, you need to drink more water. If you're consuming a lot of fluids in another way, like it's not a good thing, it would still be a pathological thing, but like let's say you're bleeding a lot, or you had abnormal menstrual bleeding or something like that, or you were breastfeeding, you're producing extra fluid, you need to drink a bit more water. So those kinds of things do make a difference. But if all these other things are normal, conditions are normal, and the person's just like, wow, I'm so thirsty, then that could be part of that pathology, like why are they thirsty? And so that's part of they could be very thirsty. They could be drinking a lot of stuff because they think they're trying to be healthy, and then that could be buggering up their spleen function of transforming and transporting. So these are all things you want to think of when you're asking those questions. The second thing the spleen does, which is really important to know, is it controls blood. So we already talked about this when we did the liver and the heart and the wood and fire. So the earth aspect of blood is that it controls blood. So what does that mean? The liver stores the blood, which is like the nourishment of blood when you're sleeping. The heart controlling the blood is more about the vessels itself and the pumping of the blood, the circulation of blood, and that reliance of wood to circulate the blood and having enough volume of blood to circulate blood in the spaces the body needs. But the making of blood or controlling of blood, so some texts I've read have said the spleen makes blood, is through the diet. So how do you make blood? You have to consume products to make blood out of. You can't make blood out of air, out of breathing only, right? Contrary to some people's popular beliefs. You have to have a substance to make, you have to ingest something in food. So this comes again back to diet, and so this is where the spleen and the functions of that, the spleen zang, or the earth aspect, is that center of our body. Now the spleen is often looked at as the center element. So there is a configuration of the 5 elements where the earth is in the center, and all the other elements are kind of coming in and out of that and receiving their nourishment from that. So this is one of the fundamental pillars of health in Chinese medicine, is diet. So what you eat, whether you eat too much food, not enough food, the wrong kinds of foods, and all that sort of stuff. And then therefore go back and watch that video, see what are the main things you should be eating, or patients should be thinking. You should be thinking about in the kind of food advice you give patients. Now most Chinese medicine schools also teach a Chinese diet therapy type of unit. Not all schools, because I've realised like recently in Australia a couple of schools have dropped their diet therapy units. And that's one of the subjects that I teach at university level, Chinese medicine. So in the bachelor degree they still teach that at the school that I teach at. And it's really, really useful for students to, one is to understand like, okay, well what should I eat myself, and how should I try to go about being healthy, and how can I use foods to maybe look at intervening in a condition when it's at the very early stages of a condition. So like, how would I use a herbal tea? When would I drink a chrysanthemum tea if I was feeling hot, maybe had a bit of a sore throat, something like that? Those kinds of things are where food interventions are very popular, right? But also to know how to advise the patients on this, like looking after your spleen and your earth energy, but really from a much more detailed perspective. So you kind of go through that spleen and stomach is the cooking pot on the stove analogy, and that has to be kind of cemented in your mind. So if it's not already, then go and watch that video. But really, I would encourage you to try to cement that in your mind. And the best way to do that, well, I find the best way to do that for me, was to repeat it to patients over and over and over. So to basically just show patients that. So when you're in the student clinic, take those opportunities that you can to explain, hey, this is what you don't have to explain all of the details, but enough for the patient to understand why they should eat cooked foods, rather than just saying, oh, raw foods are bad, and off you go. And the poor patient's thinking, oh, I've really tried so hard to be healthy. And then sometimes that's what an AHPRA or another practitioner has told them to do. So in a general sense, our body's warm. It likes warmness. It likes that warm nourishment of foods, and so everything doesn't have to be cooked to obliteration. Everything doesn't have to be cooked up, stewed up, but it needs to be generally cooked. So the controlling of blood is another aspect of keeping blood within the vessels. So there's an idea when you have bleeding that when you have bleeding, your body becomes colder because you're losing warmness from your body. So blood carries yang, and so when you lose blood, that patient generally becomes colder. And so in a herbal sense, we often use warming herbs to treat that bleeding condition, or to stop that bleeding. That's a very common methodology of herbal medicine. And you could probably follow a similar thing in foods, but if a patient's got to the point of having bleeding, I'm talking about, in this case it'd be like menstrual bleeding, then like it's probably at the point where they need herbs rather than just, here, try some of these foods. So this other aspect, so within bleeding you have two ways blood can come out. One is it leaks out, or the other way is it's kind of forced out of the vessels, or it comes out profusely. So if blood's leaking out, it could be that cold kind of condition patient, but it's coming from a deficiency of spleen or earth function to hold. So part of the earth function is a holding function, holding the blood within the vessels. And if that's not happening, because when we look at one of the other functions of the spleen to what they call control the raising qi, again, it's holding the organs in their place. So it kind of relates back to that again. If you get a prolapse, that's a spleen qi, a severe spleen deficiency, like what what's called a spleen yang deficiency. So no longer just a spleen qi deficiency, but a yang deficiency. So the spleen function of holding includes this holding. So controlling the blood is also this holding of the blood within the vessels, keeping the blood in the vessel. And a good example would be a blood nose. So you sometimes see people get a blood nose in two ways. It'll either leak out, or it'll kind of like spurt out, like a fountain almost. Like sometimes people can be very hot. I've seen this with little kids, right? They run around, they're in the hot weather. And sometimes it can be because the weather's dry, so they're breathing in through their nostrils all this dry air. And I don't know if you've ever been in a bushfire, but that can happen as well, like all this dry, hot air. And so it actually damages the fluid around your mucous membranes, and that dries it out. And then if you put any force on your nose, like you were to blow your nose a little bit, then the blood vessels could more easily burst and blood could come out, right? And so this forcing of blood, or this forceful nature of blood, profuse bleeding, usually sudden kind of bleeding, is more a heat issue. So in TCM, they think of that as heat in the blood, heat forcing the blood out of the vessel, right? Whereas in the other type of it, where you get the leaky blood, it's blood leaking out of the vessel because there's not enough energy of the body, like this would be earth energy, there's not enough earth function to hold the blood in the vessel, so the blood leaks out. Now you can see this in menstrual bleeding as well, like some patients have abnormal periods or something like that, and they might have bleeding in between the cycle, and they might just have a little bit of leaky bleeding, like not profuse. But if it's profuse and heavy, that tends to be associated more with a bright colour blood, whether it's coming from the nose or wherever it's coming from, and it's also profuse and those kinds of conditions tend to be the heat in the blood, whereas the leaking blood, the slow sort of slower bleeding, that's a deficiency. Now, you don't just take that one symptom and say, well, that's what they've got. You would think, okay, that's what that means, so let's look for other symptoms of deficiency, or other symptoms of like excessive, extreme, like heat forcing blood out of the vessels. The constitution of the person kind of tells you that as well. Like a little kid isn't going to have, we hope not, that they're not going to have a spleen qi deficiency, and they could if they had a really extremely bad diet and they were born malnourished or something like that, let's say. But in general, most kids have lots of yang, and so it's their own body's yang, which is the heat, forcing that blood kind of out of the vessel, right? Or it's the external environment and this inability to cope with the environment, that extreme heat and dryness, like if they're running around that hot dry and they're breathing in that hot dry air through their nose. So that's the first two. Now they take a little bit more time because they're very, very important functions. Next one is that the spleen controls the muscles in the forelimbs. What does this mean? So patients that have weakness in the limbs, so they might just have, this can come from a couple of different aspects that relates back to the spleen. So if a person gets damp and they're overweight, they tend to not exercise as much, and so their muscles naturally become weaker. They atrophy, or they're like there's more yin in that than yang, because they've got a lot more fat and density there, and that sort of stops them from being able to exercise as much. And especially people that are really, really obese, that have a lot of fluid retention, then that affects the functionality of their muscles and their forelimbs. Therefore they become weak. So it's a kind of a catch-22 situation, but you can see how it relates into the spleen as well. So the other aspect is people don't have to necessarily be overweight for this to happen. They can be really, really thin, and they can feel like their legs and limbs, their forelimbs, don't have a strength to them. They just feel weak. They feel, in a damp situation, they feel a sense of lethargy, which is like wanting to lie down, and heaviness. So that's a big symptom. Heaviness is associated with dampness. In a weakness, it's like the person goes to pick something up, they just don't have the strength to kind of do that. Or like some people they can rustle up the strength to pick up some bags and carry their stuff, and other people have weakness of the limbs. They just can't lift heavy weights. They can't lift, they can't lift their suitcase up or something like that. So also as people age, this is another thing to consider, and it sort of helps us to understand that aging process as it affects the spleen and stomach, because usually elderly people get a lower and lower appetite, And sometimes what can happen is they really don't eat much food, the proper nutrition or proper food. In general, elderly people need less food than when you're younger, and that is a healthier way to live because you don't need to be bombarding yourself with excess food. But if a person is wasting away, muscle wasting, atrophy, that's related to the spleen function and the earth function of looking after the 4 limbs. Number 4 is it opens into the mouth and that manifests in the lips. So the mouth itself relates to the spleen, and the lips relate to the spleen, but particularly in blood. So blood nourishes the lips. So if a person gets blood deficient, they tend to get really dry lips. So it's usually the blood aspect of the spleen that we're talking about that's, affecting the lips. So, when we're talking about other organs like the heart manifesting in the complexion, if a person just naturally has very dry lips, then you might think, okay, maybe there's something going on with the spleen. If they have a very dry complexion, like as in their facial complexion, you might think naturally there might be something going on with their heart. If they have a very liver as the nails, we talked about that already. So if they just have naturally very brittle or dry, not malnourished looking nails, or nails that get infected easily or something like that, then you might look at the liver. So this is how you want to utilise this information. You see that, you think you should know these correlations between the Zang-Fu, where does it relate? So where do these things relate? You just have to memorise them. And then number 5 controls the raising chi. So that's what I was talking about with this holding in. So the holding of like here, it's the spleen's energy that's like holding everything in its place. So how does it get out of its place, right? As we age, or when we have a severe traumatic thing, could be emotional trauma or a physical trauma, like this often happens after women have a baby. They get prolapsed uterus, let's say, or people get hemorrhoids. It could be associated with a blood deficiency kind of condition, or it could be a chi deficiency, and it's basically a functional deficiency of the earth energy, the spleen, to hold the organs in their place. So any kind of prolapse would be attributed to that failure of the raising chi. So it doesn't really matter. I mean, you can't cut the body open and say, well, there's the raising chi, there's the Zhang chi, there's the Zong chi, all this. Like, it doesn't matter. It's just all chi means functional, like the functional aspect of that. So that function of holding organs in their place is done by the earth. And so when someone's function of holding the organs in their place fails, then you think of the earth, you think of spleen. And then houses the thought. Okay, so mental emotional functions, the spleen and the earth relates to the yi, which is the intellect. Okay, so thinking, like critical thinking, conscious thinking, especially if you're a student watching this and you're thinking, yeah, okay, I have to do a lot of thinking, or people that can very easily think through problems or solve problems, think through complex situations. That all is reliant on your spleen energy. And this is where it becomes really interesting how it relates to our digestion. So I don't know if you've ever had a really big meal and then you've just gone to do some study after that, and then you've been like, oh, wow, I just really can't think. Or people that go on a fasting diet, they say, wow, my thoughts are really clear when I'm on a fasting diet, because you're not bombarding your body with food. You can't live on a fasting diet forever. Like, you can't just fast forever. And it depends on your size and your weight and your other health problems and conditions that you might have. So I'm not advocating going on a fasting diet, but I'm just using that as an example to show you that when you put food in your stomach, your spleen then has to kick in and digest it. So what it's doing is it's utilising its function of transforming and transporting. And it doesn't shut off our brain completely, otherwise we would just like pass out and not be conscious. But it drains. It's like a battery that's sort of, okay, well, it's because it's using, I don't know if you've ever had a generator, and it sort of, you can hear when it's drawing on its resource, because it's got that hum, and it sort of just goes from sort of, drawing its resource. And that's kind of what your spleen's like. When you put a lot of food in there, it's going to have to use its resource to digest the food. Now, the conundrum comes when you then go and sit down at your desk and you think, I need to think through this problem. So from an evolutionary perspective, the higher function is your thoughts, not your digestion. Because if you're saying, right brain, we need to think through this thing, it might be an emergency, you might need to go somewhere, you might need to do something important. So your brain isn't going to shut down, your body's going to try to make your brain function as best it can, but that there's this tug between the two. That's one of the reasons why in healthy principles of Chinese medicine, they say don't eat and do other things at the same time. So try to keep your eating in a separate way. Now, this is really hard. I find this hard for myself, I find this hard for patients, because our Western lifestyle just doesn't allow for this. It doesn't naturally allow for this. So you have to make this a priority. You have to put this in your lifestyle if that's what you want. What that means is when you eat, you don't have other things around you. You don't sit at your computer and eat. You just do your eating. And then for about half an hour after the eating, depending on how big of a meal you've had, you might need to just not do much at all. You could go for a light walk, maybe 20 minutes after you've eaten, little bit of exercise up, not go to the gym, right? Little bit of exercise, just moving, get the circulation going, that's good. And then you'll probably feel good. So if you're the sort of person or your patients are the sort of people that sit there and eat and do, especially solving complex problems, and the worst one is eating and getting emotional. So eating and getting in an argument with someone, or having an emotional strain at that time would be really detrimental. It's okay to eat and have a conversation. I think I made a video once and someone said, "Oh, you said don't eat and talk." You can sit, like you can have a conversation with people, but it's just not like don't get into an argument or try to do a business deal with people, right? So I do business in China a lot, and they always have meals associated with business, but they don't do the business at the table. They don't sit there whilst the carousel of chicken feed kind of going around. They want you to enjoy the company and just, you have a conversation. You can talk about whatever you want to talk about, but you don't talk business then. You don't do the deal then. You don't talk about the nitty-gritty of the deal, because especially if you're doing business, let's say, that can be quite stressful. Even if you're enjoying it, it's still like if you're the one doing the deal, you have to, really put your head on, make sure it's engaging your brain way too much than it should be necessary at that point. So this is the optimal things anyway. So even if you can aim to do that once a day instead of every meal, or a few times a week, and then you can increase it, and that should help you. So housing thought, in a functional sense, is more the yi, the intellect, so thinking through problems, and also part of memorization, of learning, is the yi. So memorization isn't just the yi, but it is part of it. So especially the critical, like the thinking, is this piece of knowledge something I need to adhere to, something I need to remember, or is this piece of knowledge, a throwaway thing? Like, when you're flicking through the news and you're deciding, is this fake news or not, you're using your yi, your intellect, to decide, is this something I should take notice of, or is this fake news? Right, so the next one about the yi and the thinking is in a pathological sense, the emotion that relates to the spleen is worry. So it can be also translated as pensiveness, which is like overthinking. So what is pensiveness, overthinking? It could be something like circular thoughts. So thinking about something that just goes nowhere. It's not really resolving something. And there could be a fine line between what's purposeful, functional thinking and pensiveness. And it could be something that, as that person might say, I have anxiety, or I have a condition where I think a lot, and they already have a diagnosis of that. Or it could be just a habit that person's not aware of. And it might not be a full-on pathology. It might just be that, they have a tendency to just not be able to stop thinking. And sometimes your patients are going to tell you it happens when they're trying to go to sleep. So, or they worry a lot. Like someone goes out, the kid goes out, and they think, oh, what if Johnny has an accident? What if this? What if that? And they just can't stop worrying. Now, if it has a fear component to it, that's a little bit different to just the circular thinking and the inability to stop thinking. So a fear component is more of an anxiety kind of condition, and that's anxiety really fits in with like worry and fear, which are two different. They relate to the earth and the water, the kidney. I think I did a video on this about anxiety actually, and it was talking more not for students, but just for patients. But that could be quite interesting. If you're interested in that and you want to know about that correlation, you could go and watch that video. So then finally, so there's a few other little aspects in the back of this chapter, but they're really the main ones. Okay, so it controls the transportation and transformation of food and fluids. It governs blood, or it controls the blood. Let's start that again. Oops, fucked that up. So it governs the transformation and transportation of food and fluids. Secondly, the spleen makes blood or controls blood. 3, it controls the muscles and the 4 limbs. It opens into the mouth and manifests in the lips. It controls the raising chi, so holding the organs in their place. So this is one of the things in pure TCM, if that's the style you're going to do. If there's a prolapse, it's always the spleen. It's always that spleen raising chi. And number 6, it houses thought, or the yi, the intellect. Just as a little side note, because spleen chi deficiency is such a common pattern of disharmony, I would encourage you as a student to just memorise those symptoms of spleen chi deficiency. So if you're watching this and you're just doing foundations of Chinese medicine, that you're not up to that bit yet, that's fine. But if you are struggling to memorise, to learn the patterns of disharmony, spleen chi deficiency is one of the main ones. And something that distinguishes spleen chi deficiency and spleen yang deficiency in traditional Chinese medicine, in the TCM system, would be the level of diarrhea that people have. So if they have loose bowels, like it's a bit loose or it's looser side, that's generally because what happens is when they lose functional ability of the spleen, it's again this holding of the ability to form the stools, which is you need qi or yang to do that, qi or yang, or qi and yang. And then as that loses more and more of its function, then you start to get more and more loose stools. And in one text, they would call it cock crow diarrhea. So what that means is when it's 5 a.m, like the person wakes up early in the morning when the cock crows, cock-a-doodle-doo, you've got to go and have the runs, basically, run to the toilet. So watery stools or loose bowels that are not properly formed. So the less formed they are, the more it's inclined to be like there's more of a yang deficiency there. And so when you go to pathological study, like the pathology of these things, we call them patterns of disharmony. So they're very common ones. So you can kind of have spleen qi deficiency, spleen yang deficiency. You can have blood deficiency. We don't usually call it spleen blood deficiency, but when a patient has like liver blood deficiency, still look at the spleen or look at treating the person through the spleen to rectify that problem, because especially if it's from diet. And the main ways the spleen gets into disarray is one would be diet, and secondly could be sleep. If the person had a lack of sleep, and then that affected their blood storage issue aspects, and then could affect the spleen controlling the blood. But the diet is the big one. It's not the only thing, but it's the biggest one. And so I hope this video has been useful and helpful to you. And if it has, then don't forget to leave a comment below. I'd love to see if this is being helpful to you. Let us know if you've got another question or something. Maybe I didn't cover something in this video and you'd like me to cover it in the next one. So I look forward to reading your comments below. Thank you so much for watching and listening. And if you're listening online on the YouTube or Facebook or wherever you're listening, I hope you have found this good, and have a great day, and I'll see you again on the next video. Thank you.